We're improving community support in Devon for people with serious mental health needs. The Community Mental Health Framework is a national initiative and the most exciting development in mental health for a generation. At its heart is more joined-up working between all of the agencies involved in supporting people in their communities. It's about supporting the whole person and all of their needs, including their physical health needs. In Devon, we will see increased investment of around £15 million, and we will expect to see more than 130 new mental health roles in the community. These will include peer support workers and recovery navigators.
Being party to a lot of the conversations around the Community Mental Health Framework and meetings about development, there's been a lot of positive work in pilots around the country. And I think that the focus and what we're being asked to do is to look at truly integrating with other health and social care partners and other stakeholders in our local communities to wrap care around that individual. What do they need to keep them in better health, to enable them to recovery after going into crisis? And also asking service users what they want. And I think that there's been a large voice that what they would like is more peer support and enablement and care and support, not high-level interaction with nursing teams and doctors and therapy.
What is at the heart of the plans to implement the Community Mental Health Framework in Devon?
To me, the Community Mental Health Framework is providing a really great opportunity to change how we help care for people and how people with mental health care for themselves in our communities. It is looking at a really holistic approach and reducing the amount of reassessments and the journey for a person so that they feel held all along the way, that they're listened to, that they're getting the right people involved with them at the right time.
Often the GPs are the first port of call for someone who's presenting with a mental disorder or with difficulties regarding their mental state. That relationship's really important because obviously that person feels safe enough to approach that GP. From that point on, that GP to be able to have access to us as a CMHT, to have some advice regarding prescribing or around what other support is out there. It's important that we have that discussion and encourage that to continue.
I think that my perspective has changed through this sort of closer interaction with our local teams. Prior to this, trying to instigate any part of the Community Mental Health Framework, it's been quite isolating in primary care and quite scary at times. It can feel as though patients are getting pushed from pillar to post, they are flip-flopping between services, back to GP. And then you're left with this person who's not ill enough yet, and we have to wait and try and hold them in the community. You've felt as though you have to wait for somebody to deteriorate into crisis until you can truly get them help.
How is it going so far?
The work that we've already embarked upon within our local primary care network, alongside our community mental health team and our other local partners and stakeholders, is very positive. We have weekly meetings with our community mental health team, psychiatrist, manager, mental health assessment team, alongside our voluntary sector counsellors, our PCN employed counsellors, social care, drug and alcohol team, police service. So we're expanding all the time.
How important is the voluntary sector in the plans?
I think that they're very important, and I think that we can see from a national level, organisations like Mind and Rethink around mental health have been very important, but locally we have several counselling services run by CICs and the voluntary sector. West Devon CVS provide our social prescribers and they oversee that. So we're already linking in locally. Overarching strategy is great, but you've got to be allowed to have that local flexibility to truly reflect what your local population needs. A lot of that must be based around population health management data, but also community engagement. Go out and ask our community, what do they want, what do they need? Looking at our local gaps in service, what do we provide currently, including what is on offer with our voluntary sector. In my primary care network area, we're very lucky that we have a great working relationship with our community mental health team, but we want to expand on that. They've been very keen to improve our community offer to people with mental health, and we're all pulling in the same direction. We would like our hands untied to progress this further.
Having been doing this for the past year, and working in this way, we've seen a change in regards to the number of people referred to us. We've seen numbers go down in relation to that, but we've also seen a more cohesive way of working with someone and sharing ideas and sharing risk. So we're able to think more creatively around what will be helpful to that person.
What would a better future look like?
In 2 to 3 years' time, how I would want good to look like would be I have someone sat in front of me in my GP surgery who is struggling with their mental health, and I feel confident that I know who to talk to and that I can get them help because I have regular dialogue and contact with our local mental health team, our local community support, whether that's voluntary sector counselling or whether it's some sort of social prescribing groups, that I can get that person what they need. Whereas in the past, I would have worried that maybe I'll refer this person and they'll get turned away and I'm not sure how to help them.
I suppose in an ideal world, what would be nice would be where people aren't waiting for treatment or feel that they're putting their life on hold waiting for us to help them to move forward. It's really exciting to think that so far we've achieved so much in such a difficult time with such little resource. It would be really interesting to see what happens next.
If you would like to find out more about how we are improving community mental health support, please contact livewell.pressoffice@nhs.net for more information about Plymouth, dpt.cmhf@nhs.net for information about the rest of Devon.